Hey, good morning. It is JK live on location at National University Health System. I'm with Dr. Yeo right here today. Good morning, sir. Dr. Yeo Wee Tiong, he is a consultant at National University Heart Centre, Singapore, also an assistant professor and alumnus at NUS Yong School of Medicine. Today, we are here to talk about something that involves a lot of people. My wife likes to talk about this. My mom, in fact, has this. Hypertension. What exactly is hypertension?
Essentially, hypertension is a medical condition where we find that the blood pressure that we measure is higher than the normal ranges. So usually by definition, we regard a blood pressure of say 140/90 to be in the more than that, to be in the hypertensive range.
So I want to ask this question. You said 140/90, right? Okay, my mom takes a blood pressure almost every day. And she said, wow, I have high blood pressure today. How? And I look at the numbers and I've gone online, I've Googled it. I'm very sad to say I still don't understand what these numbers mean. Can you explain to us?
These numbers come about as the normal way the heart functions. So as the heart brings blood around the body, it has a series of alternating, contracting and relaxing movements. So when the heart contracts, the pressure that we register is slightly higher. We call that the systolic pressure. And when the heart relaxes, the pressure is slightly lower, and that gives us the diastolic pressure. So therefore, in a typical blood pressure reading, say if you have a reading of 120/80, that would just gives you the values of the blood pressures at the different parts of the cardiac cycle.
So hypertension, let's say if someone has it, is that called high blood pressure? Obviously, right?
Yeah, so hypertension is just the medical term for high blood pressure, really.
And let's say if I have high blood pressure, are there things I'm doing wrong with my life? Like, for example, my lifestyle? What leads and what causes high blood pressure?
Yeah, so actually today you'll be surprised to know that actually we are still not quite clear why the blood pressure gets elevated, but we do know that there are associated risk factors that can predispose people to have higher blood pressures. And one of the chief things is age. So generally people, as we age, the blood pressure can creep up. And other lifestyle issues, for example, if you find your body weight not in the correct range, you are slightly on the obese side, that also can predispose to high blood pressure. And if let's say we are finding that you are taking a lot of salt in your diet, that can also elevate the blood pressure. And the other thing is also if let's say you are quite a sedentary person, that can predispose to high blood pressure.
Can I ask, so high blood pressure is a condition, but can that kill you? Like, what does high blood pressure lead to?
So high blood pressure is actually a very serious thing in the long run, because if it's not controlled, it can lead to many complications, some of which include, if you just look at the heart alone, it predisposes to heart failure and heart attacks. In the kidneys, it can cause long-term kidney damage, and you might wind up with kidney failure and might need dialysis. And it can also predispose to getting strokes, which can leave you paralyzed and things like that. So it's something that's very important to take care of.
I had no idea high blood pressure can lead to so many serious ailments. Like seriously, I had no idea. I'd like to ask you right about now, when it comes to high blood pressure, my wife always says it because I'm a stressful person. Like, I'm always stressed. I like to be, driving myself at 1,000 kilometers per hour. Can being stressed and being angry, can that lead to high blood pressure? Is that what causes high blood pressure as well?
So what we do know is people with anxious personalities, the go-getter types, they can have higher levels of blood pressure. And in fact, if you're stressed, it's actually your body's physiologic response to elevate the blood pressure to help you cope and tide over the period of stress. And but of course, in the long run, if you imagine you are stressed all the time, that's not good either. So I think it does help if you take it easy.
Let's imagine I have high blood pressure. Choi. Let's say I have been struck with this ailment, this condition. What can I do to avoid this getting complicated?
Yeah, so I think the key thing is really to get the blood pressure in check. And then I think you'll be surprised to know that once you have high blood pressure, the first thing to do is actually not to take medications. The first thing is to really look at your lifestyle issues that actually predispose, like I alluded to earlier, like sedentary lifestyle, salt intake, whether you exercise and things like that. If you can take care of those things, sometimes these can lower the blood pressure effectively. And we find that actually we may not need to take medicines.
Is wife nagging considered a cause of high blood pressure?
Well, you're putting me on the spot there. I'm married too.
Okay, I like to ask when it comes to high blood pressure. Let's say I'm a young person watching right now this video, and I do not want to get high blood pressure. But my job hours are long. I don't have time to exercise that much. What would you say? Advice to the younger watchers, younger people watching this video. What would you say to them to avoid having high blood pressure?
Yeah. So I think the diet has a large component to play. So you probably have to watch out on the salt intake. So really try to resist that bag of chips. Just reduce the salt intake. And I think with regards to salt, I think there's this other thing also, because a lot of the salt in our diet comes from processed foods. So if you go with natural, unprocessed foods, then they can go a long way to help reduce the salt intake.
What an informative morning. First and foremost, I'm pretty scared that I might have high blood pressure. I'm going to go to doctors and check it out first and foremost. Any last words you want to say to people watching right about now?
Yep, so always stay healthy, and that goes a long way to preventing high blood pressure, and go for screenings as well.
That's exactly what I want to do. In fact, you want to find out more about the NUS Yong Lulin School of Medicine, go to this website right now. I'm very happy to let you know that, just like Doctor said, there's going to be a free public health screening pretty soon. Pay attention in the next few seconds.